Hello everyone, this is Brainless Medico and I am Dr. Manoj, and today we are going to learn one more important topic under cardiovascular system, that is Pulsus Paradoxus. It's a very important topic. It may be 3 marker, even in 5 marker, and even it is very important question when you take a CVS case in your practicals. So let's take a brief understanding what you can write under this topic in the exams and even what you can answer in your practicals. So let's dig into it. Pulsus paradoxus is characterized by a decrease in systolic blood pressure more than 10 mmHg during inspiration. So, a radial pulse that becomes smaller in volume may disappear during inspiration and becomes larger during expiration. Just remember, there is a graph which shows normal, and during inspiration, there may be a small graph, and this compensation will be shown in the next graph. That's how the meaning actually Pulsus paradoxus. It is a misconception. That's it. So the important points you need to learn in this topic is a fall in systolic blood pressure of 3 to 10 mmHg. Most commonly it is less than 10 mmHg, and a small reduction in pulse volume during inspiration is physiological. As I said, less than 10 is normal. It's fine because of respiration, diaphragm movement, it is accepted. Pulsus paradoxus is an exaggeration of this normal phenomena, not a reversal. Okay, remember, it's not a reversal. The paradox is that heart sound remains audible even when the radial pulse is not palpable. In mild cases, radial pulse volume may appear normal because there will be a small changes which is negligible or not noticeable. However, sphygmomanometric measurements during slow respiration will show a more than 10 mmHg fall in systolic during inspiration. Then coming to mechanism, first we will look into normal physiology, then we'll go into Pulsus paradoxus physiology. So in normal physiology, we have to look into during inspiration, decrease in intrathoracic pressure leads to pooling of blood in pulmonary vasculature, increases venous return to right ventricle. Okay, then this leads to decreased venous return to left atrium and left ventricle. So decreased cardiac output, which leads to decreased systolic blood pressure by 3 to 10 mmHg, which is normal. So less than 10, remember, it is normal. Then coming to in Pulsus paradoxus, what happens? Inspiration caused marked increase in right ventricular volume. This leads to bulging of interventricular septum into left ventricle. So this right will be bulged into left portion of the ventricle, which leads to decreased ventricular filling. Further, cardiac output will be reduced. So venous return is decided by right side of the heart, right? And what you say? Cardiac output is decided by left side of the heart. Okay. So tell me, which is systemic circulation, which part of blood heart is related to systemic circulation, and what do you say, the venous circulation. Then results exaggerated fall in systemic blood pressure, which will be more than 10 mmHg. As I said, less than 10 is normal. If it is going more than 10, it is Pulsus paradoxus. In this condition, like severe asthma, obstructive airway disease, and tension pneumothorax, there will be excess negative intrathoracic pressure is generated. Enhanced pooling of blood is seen. Pulsus paradoxus will be seen. Conditions associated with Pulsus paradoxus, we have constrictive pericarditis. We will detailedly learn this constrictive pericarditis. Just as of now, remember, your heart has outer covering pericarditis. Due to some instinct, it has become fibrosed. So there will be no further, the heart cannot accommodate more than that limited space. So it has to be restricted. So this is called constrictive pericarditis. The other topic which you are going to parallelly compare with this is cardiac tamponade. Okay, the second cause is cardiac tamponade. These are completely like we can study it in a versus comparison way. We will learn it in like that. Then other causes pericardial effusion, restrictive cardiomyopathy. Everything is restricting. Even cardiac tamponade, it is limiting the capacity of the heart musculature contraction. And coming to pleural effusion, even it is doing that thing. Restrictive cardiomyopathy, even it is doing the same function. COPD, severe bronchial asthma, and tension pneumothorax, even it is restricting. So mota you need to remember is restricting things are the cause for the Pulsus paradoxus. Then reverse Pulsus paradoxus, inspiratory rise in arterial blood pressure which is seen in hypertrophic cardiomyopathy. We have cardiomyopathy, important topic. In that topic, we have hypertrophic cardiomyopathy, hypertrophic obstructive cardiomyopathy, and other subtopics under the hypertrophic obstructive cardiomyopathy. We will learn that. Then intermittent positive pressure ventilation. Then we have AV dissociation. So I think it was sufficient for your 5 marker or 3 marker. Most probably they'll ask this for 3 marker. If they ask for 5 marker, the important topics I covered, subtopics, you can just stretch the answer. The main thing you need to remember, less than 10 is physiology, but if it goes above 10, it is pathology. We call that condition as Pulsus Paradoxus. I hope you people enjoyed the video. Don't forget to subscribe, like and share. If you have any doubts, you can use my comment section. I'll be answering quickly whenever I'll be getting the time. So no need to worry. Study well. Cardiovascular system is very vast. So you need to make things simpler so that you can revise quickly. Thank you.